What is infertility or subfertility? Whenever a couple is trying for pregnancy, they have to continuously try for pregnancy for a period of 12 months. At the end of 12 months, if they are not able to conceive, we term them as subfertile couple or infertile couple. What is the percentage of people who land in this category? It's about, say, 20%. When people try for pregnancy, about 20% of them conceive at the end of 1 year. Even after 12 months, if they're not able to conceive, they constitute to about 10% of the total population who's trying for pregnancy. Now, what are the treatment options available for infertility or subfertility, may we call so? First and foremost, for not everyone, we advise IVF as the first option. First, we evaluate, see everything is okay in both men and women, do certain tests like scanning, hormonal tests, tubal analysis, semen analysis, and then take a call as to how this particular couple has to be treated. Not everyone is the same. Every person who's trying for pregnancy is different. Every body is different, so we need to analyze what suits them the most to achieve pregnancy. Suppose if everything is good, we would go ahead to try for a normal pregnancy. In case if the normal pregnancy is not happening, then we step up the treatment to intrauterine insemination. The final option would be IVF. Now, you may ask, when do we recommend IVF as a first choice of treatment? So let me tell you what IVF means basically. Generally what happens, the egg and the sperm meet within the body. What I mean within the body is the sperm fertilizes the egg in the fallopian tube. So this happens naturally, and that's why we call it as a natural pregnancy. Now when this is failing to happen in the body, we extract the eggs out, mix it with the husband's sperm, we make sure that it gets fertilized in the lab. Because it's being fertilized in the lab, that's why we call it as in vitro fertilization. When the fertilization is happening in the lab, in the dish, the petri dish what we call. So hence this procedure is called in vitro fertilization. When do we offer IVF or in vitro fertilization as a first option? Firstly, most important cause would be the male factor or male infertility. Yes, male abnormalities like abnormal semen test, abnormal count, abnormal motility or abnormal normal forms. So these contribute majorly to infertility, and IVF would be the first option. By male fertility, what I mean is low sperm count, we call it as oligospermia, oligoteratoastenospermia. Azoospermia is absence of sperms. I'm sure many of you must have heard about azoospermia. So when this happens, we offer IVF as a first choice of treatment, because for a normal pregnancy to happen, the sperm count, motility and normal forms has to be normal. Secondly, whenever the tubes are blocked. What do I mean by tubes? There are fallopian tubes. So these are tubes, these are pipe-like structures which is present next to the uterus, which is connected to the uterus, which helps to transit the egg from the ovary into the uterus. The egg and the sperm meet in the fallopian tube, forms an embryo. This embryo comes and gets deposited in the uterus. Suppose if the tube is blocked, then the egg and the sperm can't meet, and definitely it wouldn't be resulting in pregnancy. So in IVF, we are going to bypass the tube, form the embryo in the lab, and then we place the embryo back in the uterus. Thirdly, when people have been married for a very long time, say about 10 years, 15 years with absolutely no pregnancy, like not even a miscarriage or ectopic pregnancies earlier. So such people also should opt for IVF as a first option. People would have undergone plenty of cycles of intrauterine inseminations, IUI, as what layman knows. If there are plenty cycles of IUI, maybe about 5 or 6 cycles of IUI, even at the end of 6th cycle there is no pregnancy, IVF is the way forward. Now I'm going to tell you certain important scenarios where unfortunately IVF would be the first option. Woman is about 20 years, 25 years, yet she would have had her hormonal levels which are in postmenopausal levels, and she doesn't have the ability to produce egg. This we call it as premature ovarian failure, where a woman reaches menopause even when she is like 20 or 25. It's a very disheartening situation, but the only way forward for her to have pregnancy is to go ahead with donor egg and use her husband's sperm, form embryo, and this embryo can be placed in her uterus. IVF is the only option, but very fortunately IVF gives very good results in such women. One more scenario is HIV positivity. Suppose if the husband is HIV positive and wife is negative, you don't want the infection to get transmitted to the wife. In such scenarios also IVF is suggested, where we take the husband's sperm, clean everything, we try to remove all the viruses around it and then use such sperm. When we do this, the transmission rate to the woman or the wife is reduced. We do plenty of IVF cycles. Every person is different, every couple is different, evaluation is different, treatment is different. Approach to one attempt IVF failure is different. Treatment and approach to 2 attempts are different. Multiple failures, evaluation and treatments are different. IVF is just a part of your life or part of your treatment. It's there just to help you conceive. You should not make your world around IVF, around the treatment. So it's just an option to help you conceive and move forward. We at Janastha are there to help you achieve your dreams, help you, reach the doors towards parenthood. You're always welcome.